Welcome to the Waltham Forest Early Years Training SEND Passport. This training is focusing on new to early years SENCO and it's delivered by the Early Years Childcare and Business Development Service. Before viewing this webinar, you are advised to read the New to Early Years SENCO guidance document. This document can be found on the Hub and it will support you in developing your understanding of your new role as an Early Years SENCO, as well as giving you all of the need to know information in one place. The intention of today's training. We have 3 outcomes for today's training. Number 1, to support practitioners in understanding the role of the SENCO in early years settings. Number 2, to explore inclusive practice for every child in the setting. And number 3, explore and develop understanding of SEND support and the graduated approach, and also looking at the Waltham Forest pathway from SENCO Funding to EYCP. What do you believe the role of the early years SENCO to be? Pause the video here and write down your ideas. Understanding the role and responsibilities of the early years SENCO. The role of an early years SENCO is crucial in ensuring the best possible educational outcomes are achieved for children with special educational needs and disabilities. The SENCO is responsible for ensuring all practitioners in the setting understand their responsibilities to children with SEN and the setting's approach to identifying and meeting SEN. You need to be promoting an inclusive practice across the whole setting using policies and procedures in place. It's your responsibility to keep up to date with local and national practices. This may include looking at NASEN, looking at the Waltham Forest Hub, and then disseminating training support, helping to identify the needs of children with special educational needs. In your role, it's important to advise and support colleagues. You should be influencing each practitioner's level of awareness, skills and confidence in relation to children with SEND. This can be done through delivering training and advice, sharing any training that you've been on and sharing the outcomes of that training to make sure that everybody in the setting is fully informed of their own responsibilities. You'll need to be working closely with parents and ensuring that they're involved throughout and that their insights inform any action taken by the setting. Working with the child's parents and carers and key person at every stage of their SEND journey is a priority. You may also be signposting parents and carers to other services locally in the borough. It's your responsibility to liaise with professionals or agencies beyond the setting. You'll be working alongside specialists for extra support and advice, and working along these services to make sure that families are accessing the services available for their child. You need to make sure that you keep records of all pupils with SEN and that these records are kept up to date. You'll be coordinating provision for children with SEN and liaising with parents continuously. It's really important that you don't work in isolation and that you work with other providers outside agencies. This will include educational psychologists and external partners. Are there any other aspects of the role which were not included that you also do? Pause the video and think about all the things that you do in your role. The SENCO and the key person. The early years practitioner, who is usually the child's key person, remains responsible for working with the child on a daily basis. With support from the SENCO, they should oversee the implementation of the interventions or programmes agreed as part of SEND support. The SENCO should support the practitioner in assessing the child's response to any actions taken and supporting them in problem solving and advising on the effective implementation of support. The SENCO is responsible for ensuring the child's key person has a copy of and/or knows about the child's targets. The SENCO needs to make sure that the key person is involved in writing the child's support plan and, where possible, is invited to attend meetings where the child is discussed. As you can see from the diagram, everybody needs to work together. The early years SENCO needs to work closely with the key person. They need to be completing assess, plan and do review, as well as working alongside the parents, and always considering the child's views and preferences. This helps to adopt a person-centred approach. Role of the SENCO. Thinking about the role of the early years SENCO and your practices in your own setting, what 2 or 3 aspects of the role are your strengths? What areas do you feel you need to improve, and what areas of your own practice do you need to develop? How could you improve these practices? Have a think about what qualities make a good SENCO. This could include understanding and empathy for children with SEN, being honest about what is and what is not being provided, and having a commitment to improving the service for all children. Pause the video here and write down your answers to these questions. Inclusive practice. Thinking inclusion, what does an inclusive setting look like? If you walked into your setting, what would you expect or hope to see throughout? Think about all areas of learning and different types of SEND, as well as other areas of inclusion, including English as an additional language. Pause the video here and write down the answers to these questions. What 2 or 3 aspects of inclusion are your strengths in your setting? What area do you feel the setting needs to improve on? And how could you improve these practices? It's worth working with your entire staff team and maybe doing an environmental learning walk, looking through the setting and gaining the thoughts and ideas of the entire team where possible. Working together to support SEND children and their families. Central to high quality practice in the early years is the setting's policy and practice in relation to working in partnership with parents and carers. The impact of high quality early years provision is significantly linked to the effectiveness of partnerships with parents and carers. Local authorities, early years providers and schools should enable parents and carers to share their knowledge about their child and give them confidence that their views and contributions are valued and will be acted upon. Parents should be a part of the earliest decisions about children with SEN, including taking part in initial discussions and decisions as to whether or not a child has a special educational need. What to Expect When is a parent-friendly guidance document which supports a child's learning and development in the early years foundation stage. It's a really useful document for practitioners to share with parents to help them know what to expect during these vitally important years. When a child is identified as having SEN, parents are part of the decision-making process about the next steps in the graduated approach. The practitioner and the SENCO should agree, in consultation with the parent, the outcomes they are seeking for the child, the interventions and support to be put in place, the expected impact on progress, development, behaviour, and also set a date for review. Parents should be engaged throughout the cycle of action, assess, plan, do, review. Their views should inform decisions about how their child should be supported in the setting, whether special educational provision through SEND support is still required, or whether more specialist external assessments may be needed, whether staff require more specialist external advice, or if the child requires more specialist support, or whether the child may require an EHC needs assessment. What does working in partnership with parents and carers look like in an early years setting? What barriers do practitioners have to overcome when working with parents and carers, especially now? Think about a time when you've worked successfully with a parent. What worked well? Have you had any challenging experiences with parents, carers? What would you do differently? Pause the video and think about your answers to these questions. Waltham Forest has a wide range of different support available for families with SEND children. Early help. You are not alone when supporting families. Waltham Forest has a think family approach. Early help means getting in early with families to identify and address problems before they escalate. It is a responsibility shared by all the agencies who work with families. The shared responsibility means a wide range of different approaches are undertaken across a workforce that extends far beyond the local authorities' early help services. Early help, our family journey, can support with money, health, and offer parenting programs. Children and Family Centres, the Family Wheel. Children and Family Centres offer a wide range of activities, services and support to families with children under 5. They can support with child development, health services, job and career advice, family support and money management. The Waltham Forest Parent Forum. The Waltham Forest Parent Forum are a friendly, formal voluntary group of parents and carers of disabled children and young people aged from 0 to 25 in Waltham Forest. They offer networking opportunities for families, as well as giving support and advice, and holding events that families can attend. The local offer. Local authorities must publish a local offer. This sets out in one place information about the provision that they expect to be available across education, health and social care for children and young people in their area who have SEN or who are disabled. Waltham Forest's local offer can be found online at the Hub. SEN support and the graduated approach. Where a setting, this includes maintained nursery schools, makes special educational provision for a child with SEN, they should inform the parents' carers. All settings should adopt a graduated approach with 4 stages of actions. These actions are assess, plan, do and review. So what is a graduated approach and what does it involve? Settings need to follow the graduated approach and use the available resources in the local offer. This includes both universal and targeted resources across education, health and social care needs. This allows a holistic support plan to be implemented to best meet the needs of a child. We're going to discuss the graduated approach more in the next part of this video. Let's explore the graduated approach in more depth. The graduated approach includes 4 stages. These are assess, plan, do and review. At each stage, it's really important to consider, are you taking the child's strengths and interests into account? Are you including the views of the child's parents, carers and any other family members? Is your practice child-centred? Are you involving external specialists when needed? Are you consistently sharing information with everyone who is involved with the child? And are you documenting what's happening at each stage of the process? Let's look at the assess stage of the approach. When you're at the assess stage, settings should assess the needs of the child to establish what the barriers are to their learning and development. This could include the involvement of external agencies, for example, educational psychologists or speech and language therapists. You need to be thinking at this stage, what is the child interested in? What information have you already gathered from the parents and carers or family members? And what are the child's strengths as well as their needs? Plan. Settings should plan with relevant external professionals, children and families, to look at the support that is required to meet the special educational needs or disability of the child. This should take the form of a plan including the outcomes, interventions and provisions. When looking at the plan stage, consider what are everybody's desired long-term outcomes for the child. What evidence have you got that the intervention works? Think about the support that you should implement and how will you do it? What training and support needs do any staff have? What are the agreed short-term outcomes? Are they SMART? How can we build on what's working well already for the child? And when's the review meeting? The next stage is do. Settings should put in place the agreed support and interventions required. During this stage, you need to consider, are you making observations based on planned outcomes? Are you checking anything with specialists at any point? How are you going to monitor and record the child's progress? And how's the support going at home? And the final stage of the approach is review. Settings should review the support and interventions 3 times per year, and this should involve both the child and the parents and carers. At the review, you need to consider, what are the next steps? How effective has the support been? What's the support look like at home and in the setting? How is the child doing against the planned long and short-term outcomes? What progress has the child made? Have there been any challenges and what's worked well? SEND support plan writing. The SEND Code of Practice describes outcomes as follows. An outcome can be defined as the benefit or difference made to an individual as a result of an intervention. It should be personal. It should be something that those involved have control and influence over. And while it does not have to be formal or accredited, it should be specific, measurable, achievable, realistic and time-bound. That's using a SMART approach. The code goes on to say, when agreeing outcomes, it is important to consider both what is important to the child or young person, what they themselves want to be able to achieve, and what's important for them, as judged by others with the child or young person's best interests at heart. So let's think about how you write your support plans and how you include outcomes. Key points to consider are what does a good support plan look like? It needs to be clear and concise, and it needs to paint a holistic view of the child's capabilities and areas of need. Pause the video here and write down a list of what you think needs to be included in a support plan and what makes a good support plan. Development Matters and the Steps approach. The Development Matters document is used for assessment, and the Steps approach works in cohesion with the EYFS. You can see here that the Steps approach breaks up the ages and stages into more achievable age ranges for SEND children to see their progression. You can pause this video here to have a look at the Steps approach in more depth. Early Years Developmental Journeys, Early Support. There are a range of journals specific to need. This includes Down syndrome, visual impairment, hearing impairment and complex needs. Although the journals and the project ran from 2002 to 2015, these journals are still relevant to current practice. Early Support was a government-funded multi-agency approach which aimed at the delivery of services to disabled children under 5 and their families. For more information and training and guidance on the STEPS approach, please refer to the SEND Early Years Passport on the Hub. A multi-agency approach, area SENCOs. All non-maintained early years settings in Waltham Forest are allocated an area SENCO. The area SENCO will make core contact to support their allocated settings each term. This support is currently being offered through telephone calls, email and online meetings. The role of the area SENCO is to support the setting SENCO as stated in the SEND Code of Practice. In order for the area SENCO to support the setting SENCO when regarding a particular child, a parental consent form must be completed in order for this to happen. Referrals to health professionals. Settings can make referrals to Wood Street Health Centre by completing a Specialist Children's Health Service referral form. To specifically make a referral to the Social and Communication Clinic, otherwise known as SAC, SENCOs are required to complete a SAC questionnaire. This questionnaire will need to be completed and returned along with the Children's Health Service referral form. Before making a referral, please discuss this with your area SENCO. SENIF funding. SENIF funding is available to support FEE children with SEND who do not have an education, health and care plan. Please speak to your area SENCO if you are planning on making an application for SENIF funding. The application must show that the child is accessing a range of support through the setting and other agencies. The SENIF application is quality assured, and if it is not completed correctly, it will be sent back to you. Please refer to the Hub for more information or the New to Early Years SENCO guidance document to obtain further information and the forms needed when making a SENIF funding request. Education, health and care plans. Where, despite a setting having taken relevant and purposeful action to identify, assess and meet the special educational needs of a child, and the child has not made the expected progress, the setting should consider requesting an education, health and care needs assessment. When making an EHCP referral, this needs to be discussed with your area SENCO, as there must be sufficient evidence that all other sources of support have been exhausted. An EHCP referral can be made by the setting the child is attending or by the parent. This should be a collaborative referral that takes into account the views and opinions of the parents and carers of the child. EHCP referrals should be sent to the SEN team at walthamforests.gov.uk. The documentation you submit will be considered by a triage panel, and the setting and parent will be contacted with regards to the outcome of that triage panel meeting. Making an EHCP referral. We are now going to look in depth at the evidence that's required when making an EHCP referral, according to the Code of Practice. So just what evidence are you required to submit? You need to include evidence of the child's academic attainment or the developmental milestones in our younger children, and also the rate of progress for the child. This could be showing the progress through the school or setting data. You need to include information about the nature, extent and context of the child's SEN. This may include any early help assessments or any assessments that have been made by external professionals. You must include a provision map. This will show the evidence of the action already being taken by the early years provider to meet the child or young person's need. You need to submit evidence where progress has been made, if it's only been as a result of additional intervention, and if support is over and above what is usually provided. You need to submit evidence of the child or young person's physical, emotional and social development and their health needs. And in this area, you need to be making sure you draw on relevant evidence from clinicians and other health professionals, and also what's been done to meet these needs by other agencies. Remember, at the very start of this video, we said that the role of the SENCO is very important in liaising with services and agencies beyond the setting. You need to think about early help and maybe children family centres. Waiting lists are really lengthy for EHCP referrals, so it's important to make them as soon as necessary. For further information and to download any forms, please visit the hub. So now let's explore more of Waltham Forest's core offer for SEND. As mentioned previously, there will be core visits on a term leave basis by area SENCOs to settings. These are currently taking place via telephone, email or online meetings. You can also obtain targeted contact via email and telephone contact to area SENCOs. We have an early years foundation stage SEND forum, as well as online SEND partnership groups. SEND Success provide further information and support for settings supporting children with SEND. We have the All Talk project, which offer targeted support for speech and language for the setting. We have a SEND audit to support you in developing your own practice and the environment of the setting to make sure that you're inclusive as possible and meeting the needs of your SEND children. We are currently developing the Early Years SEND Passport package, which is being developed to offer a digital approach. We offer bi-weekly early years newsletters with updates. And we have the Hub, which contains information on a digital platform. So what now? Thank you very much for undertaking this training. Throughout the webinar, we have paused for thinking and reflection moments, using the ideas discussed to reflect on our own practice and our own settings. Using the notes you have written in response to the tasks throughout this training, create an action plan. Choose and identify 3 areas you want to improve and develop in either your setting or your own practice. This may be developing your learning environment and in particular its inclusivity and how inclusive it is for all children with SEND. It may be areas for your own personal development with regards to your role as the early years SENCO, or maybe developing your skills in writing effective support plans or targets. Whatever 3 areas you choose, put them into an action plan. Make sure you've got the what you want to develop, how you intend to develop these areas, and by when you expect to have this development completed by. You can pause this video here to see a range of key contacts in the team. These may be people that you'll need to contact to get further information and support. Thank you very much for taking the time to watch this new to early years SENCO training. For further opportunities, including the SEND Passport, please visit the hub where you'll find all of the SEND training and the SEND Passport. We do welcome feedback on the training we offer, so to share your views and opinions on the training available, please email eytraining@walthamforest.gov.uk. The Waltham Forest Early Years team has developed the SEND Passport in partnership with the Waltham Forest Educational Psychology team, SEND Success and All Talk.